I'm going to try to say next because the projection is not in line with my laptop that I have at hand. The cornerstone of the work that we're doing in terms of prevention, I'm going to try to condense 2 years of work in 20 minutes of presentation, and I hope I'll give it the due credit for the work that's been done. But the cornerstone of all the work that we're doing in the sense of prevention comes and emanates from the prevention standards, and this is where I have to give due credit for Giovanna for leading the work in terms of putting that cornerstone that summarize the evidence of where prevention is in the field of responding to drug use. And as you see, the 2018 revised version carries the WHO logo of criteria of reviewing the evidence of work. So at least to reflect the fact that there is rigorous scientific evidence for the work being done. But aside describing the evidence, the core component of the prevention standard is addressing a culture of prevention, of how is the thinking cap, the thinking modality needs to be put in place when prevention is being addressed so that all the agents of prevention are on the same wavelength of operation while addressing the problem. And that's the key component moving forward. So I cannot dwell too much with the time allowed for the prevention standard, but the main messages in terms of that culture of prevention goes into, next slide, please, Ali. Next. One, there is no such thing as not investing in prevention. Not investing in prevention comes at a cost, and at many times that cost is more costly than the prevention interventions themselves. So prevention should not be seen as a liability that could be invested in or not depending on the funding component. And I think the context of COVID-19 that we all went through was a vivid sort of description of the need of prevention. Next slide. But then not everything prevention is prevention. Prevention is a science, and there's a lot of evidence of what works and what does not work. And the context of WHO revision of a standard of criteria of what prevention is a key component in this. So there is no need to improvise. And the third important element that we have is that prevention is not only raising awareness about drugs or raising fears about drugs. It dwells into something much deeper than that to address that context. The fourth important message is the fact that early initiation and early ages of development, that use, that initiation of that risky behavior is not the result of a free choice that's independent from the context that the child is living in, both at several layers that we're going to briefly allude to, or the context that surround that individual. So just the context of just saying no to drugs is not enough without arming that person with the tools to overcome and to be resilient against the vulnerability they have on the individual level and beyond them. The fifth important message is the point of focus of evidence-based prevention is not the drug. So if the focus is on the drug per se as the challenge, the arsenal of responses will be around raising awareness, raising fears about drugs. But when the point of focus of the policymaker or the service provider is the person itself, the kind of responses start to expand beyond the original point of focus. And that's an important component of the prevention standard, that shift of paradigm of thinking of the response, thinking about the person and his or her development. The sixth important message is the fact that per the prevention standard, when the evidence is reviewed with regards to what works and what does not work in prevention, you can see that almost 80 to 90%, if not more, of the intervention do not discuss drugs per se, but rather focus on developing intellectual, language, cognitive, emotional, and social competencies in these children and youth at different ages of development. So assisting the milestones of development that are needed while the child is moving from infancy to early childhood, from early childhood to middle childhood and beyond. And the seventh and important message is the fact that the worst outcome that when it comes to not investing in evidence-based prevention is not an ineffective response. There is a lot of evidence that wrong prevention can actually lead to an iatrogenic effect. The iatrogenic effect is the fact that the exposure to that non-evidence-based prevention intervention per se is the cause of the risk in the children showcasing substance use. And the absence of that intervention would have been better than that intervention per se. So it is within that context, next slide, that we see that evolution of the CND articulation from the member state moving positively, and we can see that positive, first of all, mentioning the value and importance of prevention has risen by the introduction of the first version and then by the second version of the prevention standards. But also, not only that, what kind of prevention in terms of saying prevention in line with the science, in line with prevention standards, has also risen over time. And that's the key component in terms of recognizing the change of movement of prevention, and not alone the most recent resolution on early prevention that was presented not during this CND, but the preceding CND, talking about early prevention in the sense of early ages of development from infancy onward moving forward. And that's a key component. Next slide. And that's a general schematic of what we have found with regard to intervention. So we can talk about prevention starting from the time, the embryonic stages when the child is in the womb of the mother forward, in terms of evidence of interventions that we can work with. And also, there are several agents of response, several social institutions that are there. So, but there was a missing link that is articulated in the CND resolutions and not articulated in the standards, which is the law enforcement agencies. So how can they contribute to that process moving forward? Next slide. And this is where the first step in terms of move forward, we have reviewed the scientific evidence, not only in the prevention standards, because the prevention standards reflect what evidence exists, but we have went through the review of what does the science of intervention done by law enforcement reflect in terms of what worked, what did not work. And that was the key protocol in terms of reviewing the evidence. What we saw, there are lots of ineffective measures being done by law enforcement agencies and sometimes counterproductive. So that's where the process is like, how can we reorient that approach moving forward with that context of evidence that exists? By the way, this publication is open source. You can download it. Just if you Google it, it's a free PDF. So next slide. Even though the context of where the prevention standards are and where the review of the evidence of the law enforcement is, the etiological model that is addressed by the prevention standards reflect a context of ecological layers of safety around the child. Individually, as I mentioned, there are genetic characteristics, there are cognitive abilities that determine who the person is, mental health characteristics. But yes, that individual lives in the social context around them as a microenvironment, the school, the families, the peers. And the school, the family, the peers exist and are nested within a larger environment. A family that is raising their kids in the context of social inequality, conflict, availability of drugs, availability of guns, violence is different than another family. So that context of safety, that etiological model really indicates that there must be a role for law enforcement within this context to move forward. So why is there that discrepancy? Noting the fact also many member states where we're working have the security agencies have the core content of the prevention of the drug control strategies. And in many cases, the law enforcement agencies are the only agents that are available to provide this prevention. So how can we move forward in this process? And this is where we went, next slide, through this large process of Delphi review mechanism. From that review to the prevention standard as a background, to snowball more key informants that are important to feed that process moving forward. That went from March 2021 to April 2021, when we have found further researchers that have worked in this field. And then we circulated a note verbal in June 2021 to all the member states to give us, with a questionnaire, an impression of whether or not law enforcement are engaged, in what context, what do they do, and to nominate focal points. In July 2021, we've done the first technical consultation meeting, and this one was done with the actual researchers on prevention that we know from our protocol review and the snowball technique. And we invited all the focal points that were nominated by the member states, all 44 of them, to listen in to this first sort of description by the experts in July 2021. And we've done, based on that, a first draft of what the science is, and we snowballed that draft forward to a technical consultation that happened in October 2021, where in this time, the focal point nominated by the member states through that note verbal were at the front seat to talk about their own experiences as law enforcement agents or focal points that have that experience in their country, really reflecting their qualitative experience and quantitative whenever is available. And the experts from the technical one were listening in. May 2022, we have revised that draft based on this. And then in June 2022, we had the opportunity to go to Panama to work with the law enforcement agents that are in Panama to try to unpack that second draft, to test with them. How would they as law enforcement agents benefit from this? What can they learn from this? What is their impression about this? So that was a very learning experience that hopefully during the question and answer, probably we can go through it in more details, but that was the first rubber meet the road sort of an opportunity to see how we can move forward. November 2022, based on that direct experience working with the law enforcement agents of Panama, and this time the expert of round one, the nominated focal points of round two that I described, all of them were discussing with each other, right? Plus unpacking that content led to a draft 3 of that document that was prepared shortly prior to CND, designed 2023, designed, laid out, and the outcome of which is in your hands on the table. So it was a long, tedious, but iterative process of learning by doing, learning from different expertise moving forward. Next slide. What is important is we had a very large geographical representation of experiences. And that's a key richness of the development, because the perception of law enforcement agents, the role of law enforcement agents was diverse and moving forward. The experiences were diverse moving forward in the process. So that, and by the way, some of them contributed directly to the guiding document, but the actual availability of the questionnaire per se was information for us. Next slide. And this is the law enforcement, the role of law enforcement officer in drug prevention within schools guiding document. The QR code can be downloaded, but you have, I hope there's enough advanced copies that we have printed, and if there are any missing ones, we can send it to your permanent missions. But the naming of the document per se, given the context of our working, took a lot of iterative processes. Originally, we wanted to develop guidelines, but guidelines required a certain level of science. And this is where we moved, like, probably where we are now is more of a guiding document to ask the law enforcement officers that are at this moment working in prevention without inviting other law enforcement agents at the moment, given we don't have enough science of what to do as a law enforcement agent. If you are engaged in law enforcement-based prevention component in schools, this is what we want you to think of when you're approaching that process. And the context of it is maybe by changing that culture, the kind of packages that are availed will be at a different level. And by changing the type of packages that are availed, the science that's generated from the implementation will be different, hoping that this will lead to a second draft and a third draft moving forward. So this is a living document. And that's what the law enforcement focal point that were nominated and the expert talk about is a living document that will be revised over time. But at this stage where we are right now, it aims at changing the culture of prevention among law enforcement officers. It brings the law enforcement officers closer to other agents of prevention, so they don't work independently. It makes other agents of prevention that are the conventional prevention vehicle that provides services also understand and appreciate what can and cannot be applied by law enforcement agents moving forward. It hopefully would remove any ineffective or counterproductive measures that are being in place. It supports the culture of evaluation so that there will be generation of more science that is supporting the kind of role that law enforcement can be working with. It aims at improving the system of prevention because it takes a village. There's no one entity that really is responsible for the entire set of response in the development of a child growing up. So different entities have a different role. It improves the quality of prevention response. It hopefully will help the limited resources that exist be used in a better way at the country level, but more importantly, our aim as UN agency family is to support sustainable development goals. So we're talking about healthy and safe development of children and what law enforcement can provide to this effect. Next. So this is the content of the guiding document. It goes into a note for the reader to understand which law enforcement agents we're working with, and what are the limitations of this document as it is now, and what are the expectations of this document in terms of changing that mentality. Chapter 1 goes into a general context of the program. Chapter 2 dwells into the science of prevention that is reflected in the standards. What are the prevention standards really, and what kind of law enforcement, maybe the service provider, law enforcement agent, but also the management of law enforcement needs to understand in that context. The police science that exists. So basically, community policing and other sort of safety of community has a science behind it. And how can this science help absorb that prevention science of prevention of drug use moving forward? Chapter 4 is on the science of communication, how communication is done in the context of prevention, because there is lots of communication-based law enforcement work in prevention. The theory of persuasion, the theory of counter-argumentation, and how youth hear the information, and they hear it how, from whom, who are better agents of this communication moving forward. Chapter 6 talks about the potential role of in schools as law enforcement partnerships. So basically, it really kind of dwells into how the law enforcement should change their mentality of work to really kind of partner better with other agents of prevention moving forward like they do at the community level, and how to change the mentality of interdiction versus the mentality of prevention and safety, which requires two different kind of thinking caps when you're moving forward, and see the holistic view of not only like a drug use incident happened, but what are the general contexts of that led to that incident happen, and how can we support a change in that general environment to prevent it from happening again. And then chapter 7 goes into what works and what does not work in the field of law enforcement-based prevention. And then this is based on the protocol that's been reviewed in the very beginning. And chapter 8, which is a very important component, talks about the importance of epidemiology and evaluation, so that the law enforcement agent will know the context of the drug use that's happening and how they're working in, but also the importance of evaluation and difference between process evaluation, outcome evaluation, and impact evaluation, so that they appreciate the tools that they have and how they can improve in their evidence-based generation. So at this stage of the process, we will work with law enforcement agents that are actively engaged in prevention, equip them with the change of perception of how they want to work, and support new research development in that field. That's the general context of where we're working in terms of the, let's say, the first document that is in your hands. So that's the general briefing of the content. I really want to acknowledge the USINL for allowing this opportunity to materialize that document. The technical working group that is joining us online, both in the expert of prevention researchers that are with us, as well as the representative from the member states for their contribution, colleagues from the UNODC Crime Prevention and Criminal Justice section that also has contributed to it, and many colleagues from the Drug Laboratory and Scientific Service branch. But I want to also especially thank two specific colleagues of mine, Dr. Ziad Khatib, who led the kind of this technical review and the scientific review of the content and orchestrated the expert review. Mr. Ali Yassin, who's in the background, who's also kind of supported the technical development of the program moving forward. My colleague Dimitri for the administrative processes that have helped moving forward, and Yara and Ezra, who helped us in the design of the program document. And also we have an intern, Selina Herrera, that also have supported us moving forward. I will not have the chance to go through all the names that contributed to this process, but in addition to the member state delegates, you will see that also we have the expert that working in terms of academic institutions represented there that goes beyond the country delegation. And we had also a nice geographical distribution of them from Nigeria, from the Emirates, from the United States, from Portugal, Germany, from Lebanon, from Slovenia, hopefully, and from Republic of South Africa. So even the distribution of the scientific expert that supported us was diverse. And also, despite the fact that this is a document that works on law enforcement that is a male-dominated field, at least 1/3 of the participants were women, which I think also represent a nice gender representation moving forward. And with that, I will leave the floor back to you, Joanna, in terms of general context, and this is a QR code again.
Thank you, Wadia.